What if I told you a lot of the dentistry people have been getting for years is actually setting them up to lose their teeth faster? Sounds extreme, but stay with me. For decades, dentistry has followed a drill it, fill it, crown it model. You get a cavity, we remove a big portion of the tooth, and then we replace it with something artificial. But here's the problem. Teeth are not just blocks of material. They're living, flexible structures designed to absorb force, bend slightly, and function in a very specific way. And when we ignore that, we start a cycle. A small filling turns into a bigger filling. That turns into a crown. Then maybe it's a root canal. And eventually the tooth is gone. That's where biomimetic dentistry comes in. Bio means life. Mimetic means mimic. So biomimetic dentistry is about restoring your tooth in a way that mimics how nature originally designed it. Instead of aggressively cutting down your tooth, we focus on preserving as much healthy structure as possible. Instead of placing materials that are rigid and stress the tooth, we use techniques and materials that bond, flex, and behave more like natural enamel and dentin. And instead of thinking short term, we think long term. How do we keep this tooth alive and functioning for decades? One of the biggest differences is adhesive dentistry. We bond them in a way that actually reinforces the remaining tooth structure. Think of it like this. Traditional dentistry can sometimes turn your tooth into a hollow shell with a cap on top. Biomimetic dentistry aims to rebuild the tooth from inside out, so it becomes strong again, not just covered. Another key principle is something called stress reduction. A lot of failures in dentistry don't just happen because of bacteria. They happen because of force, biting, clenching, grinding. So in biomimetic dentistry, we design restorations to absorb and distribute stress instead of concentrating in one area that eventually cracks. Now, does this approach take more time, precision, and planning? Absolutely. Is it more technique sensitive? Yes. But the goal is different. We're not just fixing teeth. We're trying to preserve them for as long as possible. And that changes everything. So if you've ever been told you need a crown or you've had dental work that keeps getting redone, it might just be worth asking a different question. Is there a more conservative way to treat this? Because the best dentistry is the dentistry that lets you keep your natural teeth strong, functional, and intact for as long as possible.